So when it comes to nursing, we hear about all the bad A nurses. The ICU nurses, the ER nurses, the L&D nurses, the NICU nurses. But what about the Med-Surg nurses? I'm here to provide some tea. I want to talk about some pros. I want to talk about my experience. I'm going to talk about the cons. Oh, y'all know I'm going to talk about the cons. But I just feel like when I review everything, I see a lot of negativity. I don't see a lot of positivity. And I'm in this field, so y'all know I gotta put a little spice on it real quick. So if you're interested in hearing about the pros and cons of Med-Surg nursing, stay tuned. We're gonna jump right into it. Introduce myself. If any of you guys are new here, my name is Shai. I am a registered nurse. I do videos on nursing, beauty, and lifestyle weekly. I'm coming to you guys, of course, today with a nursing video. And it's funny because I can tell you that I'm a Med-Surg nurse, but I feel like the stigma is so bad that that's not usually the title I use. When anyone asks me what kind of nurse I am, I usually tell them that I'm a telemetry neuro nurse, because the floor that I work on is kind of like a heart floor, so heart telemetry floor slash neurology. We deal with post-stroke and seizures and those issues that don't require immediate intervention. But if somebody asks me, like, are you a Med-Surg nurse? I know back in the day, I'd be like, I'm not no Med-Surg nurse. Don't say that. But guys, I'm looking on my wall right next to me. I have a certified medical surgical registered nurse certificate, like a certification. So I'm a Med-Surg nurse. It is what it is. So it's funny when I even introduce myself, I don't want to automatically roll that off the tongue. But when I think about it, the diagnoses that we're taking care of, the plans of care that we're taking care of, a lot of things that I do at work are Med-Surg oriented. So let's go ahead and get right into the tea. I'm going to bring y'all the pros first because we need to talk about the good first, because y'all heard a lot about the bad already. We'll get to that at the end of the video. So the first thing, if you guys see me look down, I just kind of wrote down some points. So the first thing that I wrote down is that as Med-Surg nurses, you are well-rounded and good multitaskers. So well-rounded because you see a lot. It's hard for us, especially nowadays with everything going on, to even fight diagnoses that are coming to our floor. Most of the time, back in the day when I first started working, if it wasn't cardiac related and it wasn't neuro related, we usually could fight it and it could go to a different floor because we have different floors on our organization. But now it's to the point where it's like, if it's not critical, it's coming to your floor, like, period. Like, if it's not a critical care patient and it's not like a in-depth PACU or OR patient, we are going to get it. So when this happens, guys, I feel like it's a good thing because you see so many diagnoses. Even kind of when we made that change from being like, specifically if it's cardio neuro, we don't get it, to like almost everything, I feel like I learned so much, like so many diagnoses, so many plans of cares. Like, it's crazy because as a Med-Surg nurse, and I'm sure critical care nurses, L&D nurses, all the other specialties can do this, but I feel like I know like plans of cares by heart. Like, you know how you were in nursing school and you're like, I'm not doing this care plan, this is corny, this is dumb, I still think they don't make sense. But like, I know the treatment plan for a patient that is going to come on my floor for CHF. I know the treatment plan for a patient that's going to come on my floor with pneumonia. I know a treatment plan for a patient that's going to come on my floor with abdominal pain, which back, like, before we started this, like, changing in my organization, I really didn't, like, know, like, what you want to order, because I'm not going to give you no recommendations because I never get this patient. But now I can kind of have a say in my patient's plan of care, between their assessments, between their comorbidities, and actually know. So I feel like Med-Surg makes you well-rounded. It makes you, like, you know a variety of different plans of cares, diagnoses, treatment plans, etc. Now, let me just mention before I continue this video is not to bash specialties. This video is not to say that Med-Surg is better than anybody. This video is to just give some light on Med-Surg, because I feel like I said in the beginning of the video, we're often a stigma. We're often looked down upon. Like, anytime I tell people, like, even in my organization where I work or what I do, it's just like, oh, like, and a nurse is a nurse, first of all, guys. A nurse is a nurse. Specialty-wise, yes, we have different specialties. It doesn't change our knowledge bank. It doesn't change our knowledge span. We just do things a little bit different to adapt to our environment. So that is the first thing I have to put out here, because I know somebody's gonna be like, oh my god, you're bashing, oh my gosh, she thinks they're the best. No, I don't think anybody's the best. A nurse is a nurse. A good nurse could work anywhere, period. Second thing I kind of mentioned to you guys is, as a med-surg nurse, you become a great multitasker, and you also become a queen of prioritization. So this is exactly what it says. You can literally handle multiple patients at one time. You can decide if Sally Joe and Robert Adams both need you and they're calling for you, and you got to try to figure out which patient to go to first. Priorities, and you know this because you do it on a daily basis. You're used to taking care of 4 patients, 5 patients, 6 patients, sometimes even 7. So you know, who do I need to see first? This is one thing that is always my first start of my day, guys. I get my S-bars, I get my report, and I'm looking at all my papers and I'm going through. I've already went to the bedside and seen the patients, because we do bedside report. If you don't do bedside report at your institution, hop on it. It's the best thing in the world. It saves your patients and it saves your like, for real. But I see my patients, I see their S-bars, I'm looking at everybody, and that's the first thing on my to-do list for my day. Who am I going to see first? And I've gotten so used to doing that I know how to prioritize patients, and I know how to prioritize what care needs to be done, what can I wait till later, what needs to be done now, what can I delegate. You get so good at this, guys, when you work med-surg, because you're dealing with multiple people, multiple comorbidities, multiple diagnoses, and you need to know where to go. No day is ever the same on med-surg. You're never going to get all the same exact patients, all the same exact diagnoses, in your 5-6 patient assignment. So every day is different, and you just know, you have to know how to move with the wind, if that makes any sense. And when you do this for a while, you get really good at it. Last thing I talk about is one pro is you get a variety of nurses on your floor. So most of the time, like in some specialties, all the nurses are older, and then in some specialties, all the nurses are newer. In med-surg, it's a proper balance. It's not like we have 5 older nurses and 2 new nurses. It is literally like a bell curve, or literally just a wave. Like, we have our young nurses. We have nurses that have been there for like 25 years, 30 years, 15 years, 10 years, 5 years, 3 years. Our baby nurses, 6 months. Like, we have a good span, and I like that, because I feel like, one, you have so many minds available for you to like touch base with. Like, if I need help with a patient, or I'm wondering something, sometimes I'll go to my more seasoned nurse and I'll say, hey, let me know what you're thinking on this. And guys, sometimes I've learned this from precepting. When I have a patient situation, I will go to my 6-month, 1-year in nurse and say, hey, what did you learn about this last year? Because guys, they just came out of school. Use your new grads to your advantage. They know textbook. So they still have it drilled in their brain until they get to the like 2-3 year span like me, and it's all out the window and it's all practice. So use your new grads to your advantage. But I really like the variety in nurses, because it allows you to take care of your patients better, and also get better opinions and just better insight on situations that go on the floor. Guys, those are my pros. I had to really sit down, write down notes. You guys might see me looking down and think deep on the stuff that med-surg has made me. I was a baby nurse and I grew up on this type of floor. So, I really had to think what qualities made me from working in this area. Now, I can definitely tell you guys, I'm going to talk about this in my cons, but I know these qualities make us good, because when we get floated to other areas, it's like people act like they've never seen a nurse work so hard, or work so, like, on point. Like, I know sometimes I'll get pulled up to a different floor, or I'll get pulled to, like, another critical unit, but we still have the, credentials to take care of the patients, but you'll get like a lesser acuity patient, and I'll work through these patients and I'll be done like a lot of my stuff by maybe like 10, 11 o'clock. I'll sit down, I'll chart, and 12 I'm like kind of chilling until they need me for something else, and the nurses are just looking like, Are you good? How are you done everything? And I'm like, I'm used to taking care of 5 and 6 people. When I only have to take care of 2, 3, 4 people, it is a blessing in my heart because I can still get all their stuff done. I'm still going to treat every patient, give them the full assessment, the full attention that they need. Of course, every day is not going to be like that. Sometimes you're going to have a patient that's a little bit more complicated, but when you're so used to taking care of 5 and 6 patients and bang, 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 we got to get this done, you can literally just like, oh, when it comes to a little bit less patients, you know to be a little bit more critical because these patients might need a little bit more care. But it's easier for you to adjust to the rolls and the punches because you're so used to the chaos. Alright guys, so I'm not going to spend too much time talking about the cons because I feel like you all have heard them already. But I will address them just so for the sake of a pro and con video. So the first con I wrote down, like all y'all can already guess what I'm going to say. Like, do I even need to say it? Like, insert SpongeBob emoji, SpongeBob meme right here. The staffing ratios, guys, for Med-Surg are trash. Trash. We need to do better. We really do. There needs to be some type of, I know policy is currently working on stuff. I think we kind of got a wrench thrown at us when the pandemic came around because we can't really work on all this stuff right now when we're trying to work in critical mode. But staffing ratios on Med-Surg are trash. They need to be safer. They need to be better. You can get all the staffing in the world if you want, but if you don't understand that one nurse cannot take care of 8 patients that are in an acute care setting, even in long term, I praise you long-term nurses because y'all, like, I know these patients aren't as critical and they're not as acute, but you guys still, like, safe patient ratios are just, it really is something that we need to work on in nursing. But when you're Med-Surg, you literally get thrown the worst ratio, yo. Like, I remember one day, guys, I literally came to work and they tried to give me 7 patients. And guys, these patients were sick. It's not like everybody was chilling, walking around, getting ready to be discharged. Because if that was the case, alright, fine, whatever. No, these patients were sick. Like, these patients, how am I gonna take care of 7 people that are sick? Are y'all kidding? I refused the assignment. Learn to speak for yourself. I refused it. I said, if y'all don't take one of these patients away, y'all can just take the nurse away because I'm gonna go home. Like, this is unacceptable. So they had to get that together because that was crazy, y'all. But we really gotta fight for our safe ratios in Med-Surg. I feel like we kind of get pooped on when it comes to that. Another thing that's a con is coworkers come and go. Why? Because the environment is chaotic, so people don't want to stay there. And a lot of people have the mentality that when I get in Med-Surg, I get some foundation and then I move on. Do I disagree with this? No, not at all, sweet tea. I'm with it. Like, if you want to come get your foundation and then move on to your specialty, that is fine. But one thing I will speak on, guys, is if you are interested in a specialty, in my opinion, I think you should just go for it. I think you should just go for that specialty, get your wings in that specialty, because all in all, Med-Surg is good for foundation, but there's some query things that I find out. Some people get stuck, and I almost thought that was me because I thought I was going to work in critical care. I still love Med-Surg. I still might go work in critical care. I don't think I got stuck. I just had a different plan for myself. But a lot of people go to Med-Surg and they get stuck because once it's time to move, they're not ready to move. They don't move, or their life is finally in order and they're like, I'm not moving right now. Don't get stuck. If you want to do a specialty, L&D, ICU, critical care, NICU, go for it from the jump. I would encourage it. We're in a new generation of nursing. We're not in that old generation of nursing where it says you got to start on Med-Surg and get your wings and then you can fly. If you do that, it's okay. Like I said, we have nurses that do it on our floor and I'm like, go for it, sis. Like, nobody's looking down on you for doing that. But if you can get into your specialty, like, hop out of school, apply to all critical care. Hop out of school, apply to all L&D. I know a lot of older nurses are going to watch this video and say, no, absolutely not. But it's a new age of nursing. It's the year of nurse. We're doing things a little bit different in this generation, so go for it. The last thing I'm going to talk about to you guys is that when it comes to Med-Surg in organization, and I don't speak for every organization, and I don't speak on my own organization, but it's reality. It's reality. Med-Surg is often the bottom of the totem pole for organizations, even when it comes to the way administration deals with things. You guys already heard me talk about the staffing ratios. when it comes to change on a unit or change for a patient population, usually Med-Surg is the bottom of the totem pole. When it comes to simple stuff like food, y'all, let me tell y'all a story. We have been a pandemic, I'm going to use that word instead of the other word that I'll put here. We have been a pandemic positive unit for months. I've been on the pandemic positive side since I've worked in March. I floated to another floor, a more critical care floor, and worked food. I worked on another floor, food. Everybody was getting this food because they were the designated pandemic unit. My unit, since I've worked there, I think we've got food once. I'm a foodie. I'm gonna talk about this. So it's like simple stuff like that, guys. It's just like, wow. Like, why are we the bottom of the totem pole? I always call it the stepsister, the stepsister in the closet, like kind of like Cinderella. That's what I call Med-Surg units. It's the stepsister in the closet unit, because we often get overlooked. We often get bottom of the totem pole. We often don't get advocated for, and I can definitely say that too. So that is something big that needs to change, and change starts with yourself, and that's all I'm going to say right now. So all in all, guys, this is my conclusion on the pros and cons of Med-Surg nursing. If you guys want to see more videos like this, or if you want to hear me talk more about Med-Surg nursing, please let me know. I actually realized as I go through YouTube and I try to look for nurses for Med-Surg, I don't find a lot. I find a lot of, like I said, critical care, L&D, NICU, psych, all the specialties, but our specialty is still a specialty, even though some people don't think it is. Like, I feel like even though it's a foundational floor and it's a foundational specialty, it is still important. We still save lives on this unit. We will get a patient stable to get them to a critical care unit, and if we didn't know what we were doing, they would never ever get to that stable level, or they would be gone. So, like I said, in general, guys, a nurse is a nurse. We all have the same knowledge base. We all have the same, we're all on the same level. We just adapt to our environments differently, and we plan our care around the environment that we are adapted to. So all in all, I will see you guys in my next video. Don't forget to leave some feedback, leave some comments down below. Are you a Med-Surg nurse? Are you a specialty nurse? L&D, ICU, downgrade ICU? I want to hear from you guys. I want to hear, what is your stigma? That's what, I'm gonna pin that comment. What is your stigma on Med-Surg nurses? Because it's a struggle. It is a struggle. Even when you're looking at yourself as a Med-Surg nurse, it's a struggle. But 3 years in the game, gang, yes. And I'm loving it. There are days I want to quit. There are many days I wanted to quit. But we're here and we're doing it. So I will see you guys in the next video.